is Brianna Borg, who is a graduate student in the Department of Family Medicine and Public Health Sciences at Wayne State University. She is also a researcher in the Department of Psychiatry and Behavioral Neurosciences. Here she studies trauma, community violence, urban regions, adolescence, and injury prevention mechanisms. Notably, she is first author of the manuscript Circumstances Surrounding Gun Violence with Youth in an Urban Setting. Her next steps include integrating public health practices with the neurosciences. Turn it over to you.
Thank you so much for that introduction. Okay. So my project today is titled Gun Violence Exposure and Mental Health in Youth from Detroit and the Surrounding Suburbs. And again, I'm out of Wayne State University. I have no conflicts of interest to disclose. And I'm going to begin today with a history of violent crime, which reached its peak in the 1980s. And you can see from this figure that the early 90s also had high rates, specifically in 91, 92, and 93, where the rates were over 1.9 million violent crimes per year. Looking at the early 2000s, you'll notice overall lower rates reaching lows in the 2010s, with about 1.2 million violent crimes per year. This is where we roughly stand today and where we've stood for the last decade. So why do we care about violent rates and trends? Well, that's because where there's more violent crime, there's more gun-related violence, thus more preventable injuries. And it's important to focus our efforts where they're needed. The age group that is most at risk for sustaining a firearm injury are African American males aged 15 to 24. Firearm violence is largely a young person problem as young people are more likely to engage in risk-taking behaviors. And you can see from this figure here, our rates of firearm violence is kind of coinciding with the violent rates trends, leveling off like in the last 3 years. So how many lives are lost as a result of firearm violence? In America, it's 100 a day. This equates to 38,000 lives lost a year from guns persisting at epidemic levels. How are the children affected? Well, firearm injuries are the second leading cause of death for children under 18. Over the course of the year, 8,000 children are shot by a gun, 1,600 die, and the remaining 6,400 children are left with a physical injury or disability from a gunshot wound. But what about all the children who've been exposed to gun violence and haven't sustained a physical injury? Previous studies have linked gun violence exposure to behavioral problems, trauma-related symptoms, aggressive and delinquent behavior, depression, suicidal ideation, health risk behaviors, and poor school outcomes. Which leads me to my current study. This is Michigan, and you can see that the big cities have incidents of, or higher incidents of fatal and non-fatal shootings, disproportionately affecting youth in urban regions. You can see here, this is Flint and Lansing, Grand Rapids, Kalamazoo, and Detroit is just really light up pretty bright. Now I'm going to zoom in on the city of Detroit. So everywhere that's kind of like colored, you can see that this is the incidence of fatal and non-fatal shootings again. But this is the outline of the city of Detroit. All the surrounding things, things with less incident rates, are cities, what we're called the suburbs. Highland Park and Hamtramck are what we call neighborhoods within the city of Detroit. So to give you a scope of the problem with the city, Detroit has remained among the top 3 highest murder capitals in the nation for the last decade. Notably, our violent crime rates have saw a 16% increase in 2016 and has since remained high. So in order to understand what's kind of going on in our backyard, we aim to study, in our study, to compare exposure to guns and gun violence in Detroit versus suburban youth, and test for links between these gun-related exposures and mental health outcomes within Detroit youth. We used a case control method, matching 64 youth on age and gender. These youth completed validated measures on gun-related exposure using the Things I've Seen and Heard scale, on anxiety using the Screen for Child Anxiety-Related Emotional Disorders, and depression using the Children's Depression Inventory short form. We can see from this demographic table that age and sex was consistent with our selection process. In Detroit, the majority of our sample was African American, whereas a majority of suburban youth were Caucasian. The reported household income was different between cohorts, with more Detroit families earning less than $30,000 and more suburban families earning more than $60,000. For reference, the Michigan poverty line is at $29,000. So most of our Detroit population is living at or below the poverty line in this sample. Now for some results. So we compared gun-related exposures between cohorts. The firearm-related exposures included hearing gunshots, seeing a gun in the home, witnessing someone get shot, witnessing a shooting or stabbing in the home, being threatened to be shot, or grown-ups threatening to stab or shoot each other in the home. Overall, Detroit youth reported more gun-related exposures than their suburban counterparts. Detroit youth reported hearing gunshots and witnessing a shooting more than suburban youth. The other exposures were the same among cohorts. Notably, there is a high prevalence of seeing a gun in the home between both the suburban and Detroit youth. The mental health outcomes of interest for our study were anxiety and depression. Anxiety scores were the same between youth. Depression scores were higher among Detroit youth. We then looked at the proportion of youth who exceeded thresholds for detecting clinically significant anxiety and depression. This was the same between youth for anxiety, but for depression, more Detroit youth exceeded thresholds. We then examined the relationship between individual exposures with mental health outcomes. Detroit residents who reported hearing gunshots had higher anxiety and depression scores. And within Detroit, those youth who heard gunshots were 13 times more likely to have clinically significant anxiety scores than those who did not report hearing gunshots. Those associations were not significant amongst the suburban youth. We then looked at the age effects within Detroit. So 4 out of the 6 gun-related exposures that we examined showed that age of exposure was significantly different in Detroit youth. You can see that early adolescence is when children begin experiencing these exposures. And as age increases, gun-related exposures also increase. So in conclusion, our study shows that Detroit youth have different levels of gun-related exposures. Moreover, that these exposures are correlated with mental health outcomes, anxiety, and depression. Our data shows a strong relationship between hearing gunshots and reported symptoms of anxiety and depression, suggesting that some exposures have a stronger influence than others. Moreover, there's an age effects among individual exposures. So what do we do with these findings? As public health professionals, we aim for prevention and pro-safety initiatives. Our data shows that prevention efforts are best aimed at younger children as exposure begins in early adolescence. These efforts might best be aimed at different types of violence, as violence exposure is multifaceted. We also need to provide resources in these urban cities that aim to address mental health disparities, as exposure to gun violence in childhood is a distal risk factor for later victimization and the perpetration of crime. Lastly, I just wanted to address our current political climate. This is a tough topic. We are talking about children and teenagers being shot and killed every single day. We are now seeing young people having to stand up for themselves as their friends are dying and they're saying enough. Politics, with the dichotomous approach, is separating the debate into pro-gun and pro-safety. This way of thinking has proven to be fatalistic, and it's where we stand today. So I urge you as public health professionals to take a stance and advocate for pro-safety approaches so that we can create safer homes and safer communities for our children. And that's all I have. I would like to thank Wayne State and ThinkLab for providing a platform for my study, and the American Public Health Association for the opportunity to present my work.